I'm Caroline Cameron. I'm the unpaid carer lead for the South East, and I have the pleasure today to introduce you all to the Sussex Carers Health Project team, who are undertaking several excellent projects across healthcare in Sussex. So before I hand over to Caroline Pope, who is the Deputy CEO of Carer Services Director, West Sussex, who will give you a detailed introduction and a background to the establishment of the projects, can I please ask you to put questions in the chat so that we were able to ask our speakers to address any questions at the end of the presentation. This session will be recorded and the link will be shared after the session along with the presenter slides. Everybody is on mute to prevent background noise. So thank you very much for attending, and can I now hand over to Caroline Pope from Carer Support West Sussex.
Thank you, Caroline. Good afternoon. So as Caroline said, it's all Caroline's today. So I'm Caroline Pope, Deputy CEO for Carer Support West Sussex. And I'm just going to set the scene on the Sussex Carers Partnership before I hand over to my colleagues who'll give more detail on the health project. So this partnership is a really good example of innovation, and where coming together in partnership allows us to work collaboratively along geographical borders to tackle issues that are common to carers across the Sussex footprint. So the Sussex Carers Partnership mirrors the integrated board geography and covers 2 counties, East and West Sussex, and a unitary authority, Brighton and Hove. And working in partnership has allowed us to deliver campaigns Sussex-wide, such as our winter campaign delivered over the last 3 years that encourages carers to look after their own well-being and raises awareness of carers' need to be supported, that champions key messages, such as the work we've done with the NHS to support the uptake of COVID and flu vaccinations, and to align funding on key projects, such as Making Carers Count, which is a Carers Trust funded project, and more recently with the Accelerated Reform Fund, and to consolidate discussions with decision makers and commissioners. So how we work as a partnership is that we collectively determine a partner for each defined project, and this partner can channel the funds to the other partners, reducing the administrative burden on our commissioners and allowing us to target resources on feet on the ground, delivering the projects themselves and to maximise our project impact. We have a carer forum that takes place quarterly, which includes NHS leads for carers, the 3 carer organisations covering the Sussex footprint, and the 3 local authority carer commissioners. And the forum has provided a constructive way to review insight, agree actions, and to oversee the development of the carers maturity matrix, response and action plan. And it's also allowed us to access future priorities and areas of work. Next slide. Oh, sorry, I should have said first slide, shouldn't I? I missed the first slide. So if you wouldn't mind, just scroll through. Perfect. So that was the first slide. The next slide, please, then, Steve. Brilliant. Thank you. So who are the 3 charities? So Care for the Carers supports carers in East Sussex. The Brighton and Hove Carers Centre supports carers in Brighton and Hove, and Carer Support West Sussex in West Sussex. And each delivers on the carers contract for their area. Each contract is different with different priorities, but together we are all 3 of us are network partners of the Carers Trust, and together we spend over £7 million in the last year on supporting unpaid carers. We've employed 174 staff. We have over 46,000 carers registered with us. And in the last year, we've registered more than 6,000 new carers and recorded more than 146,000 contacts with carers. Next slide, please, Steve. Brilliant, thank you. As you'll know from the census, in 2021, we're told that there were 5 million carers in England and Wales, which is a surprising reduction on the previous 2011 census. And the Office for National Statistics suggests a number of reasons for this, including changes to the nature of caring and high levels of deaths during pandemic. But also it suggested that the change in question framing could have made a difference to the numbers. Whilst in 2011, the census question mentioned providing unpaid care for family, friend or neighbours, the 2021 question referred to caring for anyone. This will have had an impact, as we know that many people don't recognise themselves as unpaid carers. However, in Sussex, the number of carers remains significant, with 8.5% of the population being known to be unpaid carers. Recent research led by Carers UK and the University of Sheffield highlights the incredible increasing financial value of unpaid care in England and Wales. And I'm sure many of you will be familiar with the stat that unpaid carers are providing a staggering 162 billion a year. And to put this into context, the NHS health service spending in England in the 2021 financial year was 156 billion. Next slide, please, Steve. So the partnership. The partnership aims to seek and achieve collective funding to promote system level change and build capacity and capability in effective carer identification and support in primary and acute settings. The Sussex Carers Partnership Engagement Report in 21-22 found that we had issues to tackle. Communication between carers and healthcare providers is seen as inconsistent and leads to highly variable outcomes. This was already an issue for carers, but has been exacerbated by the pandemic. The negative impact of caring on mental health, including loneliness and isolation, is one of the biggest issues expressed by carers. Identification of carers and recognition of carers' expertise by healthcare services is generally seen as haphazard or poor. Delayed and cancelled appointments and services due to the pandemic and latterly due to the strikes are still a concern, and backup for carers and respite is critical. Next slide, please, Steve. So the Sussex Carers Health Projects. The project that we're here to talk about today is this project, which is a partnership between the Sussex Integrated Care System and 3 Sussex carer charities, which aims to create a consistent service offer to carers and health partners. The project started in early 2023. So the project components were to map existing primary practice in primary and secondary care, identify good examples, and build capacity in primary and acute settings. The project employs specialist workers to work with health partners to raise awareness, providing training, tools and resources that will enable GPs, hospital and health-related providers to embed carer-friendly approaches. And through the project, carer identification, registration and support will improve in primary and secondary care across Sussex. And now to explain more of the detail on the projects themselves, I'm going to hand over to my colleagues, the first of which is Anna Morris from Carer Support.
Good afternoon, everybody. My name is Anna Morris, as Caroline just said, and I am the project lead for Carer Support West Sussex on the Primary Care Engagement Project. Steve, would you mind popping it to the next slide for me, please? So our project focuses entirely on primary care engagement, and that's because as an organisation we have already heavily invested in engaging with secondary care providers and have a good presence in hospitals and work well with those partners around supporting carers in those environments and discharge. So ours specifically for this area of work was focused on primary care engagement. And I think there was kind of a key change in the way that we wanted to engage with primary care providers as part of this project. So traditionally, we might have been able to drop into surgeries, offer information sessions, drop-in sessions, physical in-surgery appointments, be able to do more events. And that's in part due to having, more available staff and capacity to do that work. It's also obviously a very changing landscape with COVID, and the way that we engage with each other and the way that we engage with people and the way we engage with partners has changed. And we really wanted to use this project to focus on enabling our GP and primary care partners to put the systems in place so that they could identify and support carers around their health needs and route them through to appropriate emotional and practical support with us. So it was a key change in the way that we wanted to approach our relationships with them. And that's got a lot to do also with the fact that this is a funded project and it lasts for 2 years. And I'm sure we all know in the different types of work that we do that with staff turnover or within any environment, it often takes one passionate person to make a project work and then that one passionate person to leave for it all to fall apart. So we really wanted to try and embed processes, systems, paperwork to try and help our GP partners to integrate this care identification and support process and system and support beyond the end of this project. But that is a fairly ambitious ask for us, but we're trying our best. So in terms of the project objectives and what we have done so far, we mapped care identification and support in West Sussex primary care, and that was just to get to understand what's already happening. What does good practice look like? Who is engaging in this activity already? Where are people finding it difficult? What are the challenges? Who's doing nothing? Essentially so that we could learn from good practice, build on it, showcase it to others, use them as champions of the work. And where there isn't anything happening, what are the barriers they're facing? What are the challenges? And how can we target our capacity and response to be able to support that? So we spoke with 77 we've got around 90 in West Sussex, and we spoke with 77 of those in June of last year. We were amazed actually that once you get on the phone, they're very willing to speak with us. We targeted carer leads. If there wasn't a carer lead in post, we targeted the person who would be most likely to know about carers and to be leading on that activity. So we pitched for that rather than practice manager level, but many practice managers joined in those conversations, which were either via Teams or in person. And also we made sure that we communicated with practice managers and further up the chain that this activity was happening. We're creating a carers identification and support toolkit for GPs, and that's been an evolving process. So over the course of the last 9 months, we've trialled mini campaign packs around the flu vaccination, COVID vaccination, around Carers' Rights Day. We look at different ways that they might want to engage with us. Simple things like I've got here about Facebook messages where we draft it for them, posters, website text message campaigns, just trialing different ways that surgeries might want to engage with us. And through all of that learning and through some direct piloting with 7 surgeries, we've built an online, very simple kind of what we would view as baseline foundation level support for carers. And we've created as many of the resources as we can to put that in practice. And that goes live next. It's in the development right now, so hopefully in a couple of weeks we'll push the go live button. In terms of practical assistance to help primary care partners, we're not in the team. They include me, I'm part-time, and 2 full-time workers who provide both wellbeing work direct to carers as well as the partnership work to the surgery. So we haven't got scope to go in repeatedly into every surgery. So what we focused on is communities of practice, building practice collectively, looking at learning collectively. And the way that we've done that in the main is to recruit to a carer lead network, and we have typically about 25 of our surgeries attend those. We'll always have a practice spotlight, so someone that's speaking about the proactive work that they're doing so that they can learn what it looks like in practice and how to deliver it. And then we will provide an update ourselves on the materials we've developed or what key action that we're seeking that they will take, so that there's always an evolving picture that they can think about, oh, this is the action that I can take at the moment. We're also providing now, we've moved from the mapping side of things to providing one-to-one GP support. So we'll go out and we'll look at a baseline review of the support they're providing so far, and then we'll action plan with them using all of our materials and the work they can do themselves to put in small, simple steps to improve what that care identification and practice looks like. And we've trialled that with 7 of our surgeries with really good response, although there is nervousness and people are initially a bit daunted. They think it's going to be quite a large package of work, and it really isn't. It's about very simple steps and actually just bringing what they already do into a cohesive package. So the hope is that we will 40 GPs will increase their carer registration, and 30 GPs will demonstrate improved carer friendly practice. What we will say about that in terms of the challenges is we've actually found that lots of the GPs have very outdated carer registers. They've got perhaps carers who've got guardianship of children on there rather than unpaid care workers, unpaid carers. They've got paid care workers on there when perhaps they shouldn't be on there, obviously shouldn't be on there. And they've also got people where their situation may have changed as a result of bereavement or changing carer circumstances. So actually what we expect will happen is, rather than the registration, the carer registers increasing, they may diminish, but they will become more meaningful and more proactive in how they can support the carers that are on those lists. We found that people are generally very willing to engage with this work, and that's why we've gone kind of grassroots up, focusing on the carers leads rather than the practice managers. But we are in a sea of priorities, and it can mean that whilst there's a willingness to engage, it doesn't always translate into action. And that can be tricky for us to evidence the impact of this work, or tricky for us to keep the relationship going with them to show that there is a progress. But by and large at the moment, by and large, we're finding it very positive at the moment, how they're engaging with us. And what we hope to do next is to get more kind of PCN level or practice manager level involvement, so that we can look at what could this kind of practice look like for PCNs, or what commitments could be made, what carer policy could be held at a PCN level. Could I have the next slide, please, Steve? So just to give an indication of some of the highlights so far, and these might not seem like big, results, but to us they feel quite significant, because it shows that even in just the last 8 months, that there is a real shift in how primary care are engaging with us and how they're thinking about us, and also just how they're changing the way they're engaging with carers themselves. So when I was doing our most recent monitoring reports, I found that we had a 100% increase in referrals from primary care in Q3, which is October to December in 2023, versus the same period in 2022. So it's 51 we had in 2022 up to 102 over the last 3 months. So it's roughly 33 we're getting a month now from primary care. Hopefully we'll see that increase over time as we have more of these conversations and a greater engagement with them. We do know there's a nervousness from their point of view to refer directly, and they seek a lot of carers to self-refer. We do talk to them about this, because sometimes, people can get lost from the conversation where they're really geared up to engage with us, to by the time they get home, everything gets busy. They can't remember where they need to go to be able to refer themselves to our service. But even saying that, the figure was very low for carers who were told about our services from primary care in Q3 2022. It was only 7 that said they'd heard about us from their surgery, whereas we had an 871% increase in the last quarter, where 68 of them had heard about us directly from their GP setting. So we really feel like this is beginning to land, and we're beginning to have those kind of conversations that are proving, that carers are being identified and supported. We also trialled a text messaging campaign with 3 of the surgeries. 2 of them really took it forward, and through that process, they identified 550 unknown to them carers, and actually that started to really develop the way that they wanted to identify and support carers themselves, because once they'd identified them, they wanted to make sure there was an offer of support in place for them. So that's really been able to help our conversations and how we can, think about what type of support would be beneficial to a carer within the health environment, and how can they be routed through to us. Similarly, through the course of, at the beginning when we reviewed the websites, only half of our surgeries were referring to us on their websites, whereas we've had 10 more out of 90 do that. So that's, again, another increase over this period of time of those referring to us, which we're delighted about. We've got over 30 surgeries that are represented on our carer lead network, and that is really beginning to create opportunities for engagement and change between them and in how they engage with us. We've reached over 150 primary care professionals and partners, and that's things like raising awareness of this project, like I am now, but also through care awareness training. And one of the key methods of that has actually been through a Sussex training hub, where the Sussex training hub, which is just here on the Welcome to Primary Care, they had no information about carers on there at all, and yet it's the main induction route for all primary care professionals into Sussex. So we spoke with them, we said, can we please incorporate information? And now they've done that on their website, in their induction video, and they also include us in the multi-professional meetings they've had. So we did one, Colette's on the call now, she was at one on Monday to 10 multi-professionals across primary care, and I did one for paramedics at the end of last year. We've recruited 6 PPGs to champion carer issues because we've noticed that if they're asking the questions of the practice manager, it really does help things move along. Obviously, PPGs are all stages around activation, effectiveness, quality, but they're very responsive and engaged on this. And so we're doing as much as we can to work with them. Okay, last slide from me, and then I will pass over to Tom. Sorry if I've talked for too long. I have a habit of that. Next slide, please, Steve. Okay, so the primary care dedicated portal is going live, as I say, fingers crossed, in the next 2 weeks. We are also building LMS, so that's a learning management system, some online training, roughly around 30 minutes in duration, focused specifically on West Sussex primary care professionals, and we're hoping to work with some of the larger scale confederations to build that into their induction training, the mandatory induction training, and then we'll seek the same from the primary care networks or individual practices. And the one-to-one GP surgery support, we've been piloting that over the course of the last quarter, but we hope to go live with that over the next couple of weeks. We'll start to reach out. So again, watch this space on that. And at that point, I'll hand over to my colleague, Tom. Thank you.
Thank you, Anna. Next slide, please, Steve. So yeah, my name is Tom Lambert, and I'm the CEO of the Carers Centre for Brighton and Hove. So as Caroline Pope outlined at the beginning, we've utilised this funding to essentially level up support for carers in healthcare settings across Sussex. And whilst Anna's talked to us all about the investment that Carers Support West Sussex have made in the primary care field, we did have an existing provision within our core contract to work with primary care providers already. So our element of the proposal, as was the case in East Sussex, was to improve our service delivery and introduce a carer support function at the Royal Sussex County Hospital here in Brighton. The primary objectives of the roles that we have in place, we have one senior carer link worker at the hospital now, and we also have a second carer link worker at the hospital also. Both of those staff are full-time, and they're supported with central management here at the Carer Centre. Their function is to, as you see on the slide here, develop, adapt and deliver care awareness training and liaison at the Royal Sussex County Hospital, to maintain the commitment of the secondary care staff that they encounter, to identify and support carers engaging with secondary care services, so some in-person support for carers on the ward, bearing in mind that we've got the 2 staff, but they're doing excellent work to make sure that they're visible in many different settings in the hospital, as I'll go on to explain in a moment, and to look at more longer term evergreen developmental opportunities, such as how we can begin to explore opportunities like a carer's passport potentially, and supporting different wards and matrons and ward managers to consult on their visitor or carer policies that they have in place, and we've already started to do that, as well as we'll see shortly. I mean, we're going to address similar challenges across all 3 partners, I imagine. I tried to be a little bit varied in the challenges that I identified. So it's always a challenge to kind of go in to a new setting and to build the trust and the rapport with partners that perhaps you don't have personal experience of working with in the past. But a couple of things that I've identified on top of that is that, as many of you will know, there's been a huge amount of change in just the physical space at the hospital, and that's going to be ongoing for the next few years at the very least as well. Recently opened the Louisa Martindale building, which has been a huge improvement for hospital facilities, but it also meant that we were joining as external partners on site at a time when there was a lot of flux about different wards and teams relocating just within the premises themselves. And as is often the case, we've had a different response to the service depending on which ward that you name, really. So much like Anna was saying with the GP surgeries, it's a case of this point of the project, certainly pushing at some open doors and basically getting some quick wins, so that those organisations, those wards that are really keen to embrace the service offer, take that opportunity, and then we can use those as good practice examples to celebrate, in the hope that other wards and settings will see that and feel and recognise the benefits of it as well. Next slide, please, Steve. Thank you. So we began by taking the chance. I guess this would have been the winter of 22 going into January of 2023. I had the good fortune to be invited to participate in the Winter Collaborative Group, which was a hospital-led weekly meeting discussing winter pressures, and it was attended by some other voluntary sector partners, but those tended to be ones that were directly commissioned already through various hospital-related revenue streams, typically those who are actively involved in the discharge process for patients and their carers as well. But we were able to become a member of that group, and it was through that regular ongoing meeting that we were able to forge links with a couple of key partners that have really helped us to make a good start of the project in year one. Those being the integrated discharge hub, which is where our team are physically based on a day-to-day basis, sort of our home base, and also from Emerald Ward, which is the dementia ward at the hospital, who both of those teams had very early buy-in and recognised the value of the project and its potential. So that's been a really good foothold for us. Since the workers have been in place, we've been able to expand our presence to the front door as well. So obviously we began working with carers and their families who'd been on site for some time potentially, and we're going through that discharge process. We now have a presence at the front door as well. We've launched a marketing campaign called Confidence to Care, which has materials posted to all wards for display to raise care awareness and to encourage informal referrals and to our workers, and invitations to multi-agency meeting opportunities. So link workers now attend regular discharge events. We've launched a Carers Cafe, which is a weekly opportunity for carers to join us. It is located on the dementia ward, but it is open to carers of any patients. And we have indeed had quite a nice broad representation of people, not just caring for those living with dementia. We have our link workers continuing to meet face-to-face in person with carers on the ward settings. So hospital staff are currently able to make very simple, straightforward referrals to the link workers. Over time, that may become, as it exponentially grows, that may become challenging in terms of the referral rate, but for the moment we're able to manage that. And we're having collaboration meetings with the other carer support partners who are on the call this afternoon. Final slide from me, please, Steve. So up next for us will be to continue the development of our care awareness program. So an in-person offer for team meetings and individuals who are interested, but we also have an existing online offer which currently has 4 modules, which any of you are welcome to complete. Become a carers champion yourself. It's on carershub.co.uk, and that the current 4 modules are a general module, so any professional supporting carers can complete that one. We currently have specialist modules for education staff, for primary care staff, and for employers, and we'll be in the process soon of developing a specialist module for secondary care staff also. whilst we want a longer term goal, I suppose, is to continue the exploration as to how we might work towards a carer passport opportunity. And that comes back to something that Caroline Pope mentioned at the beginning in our work together across Sussex, proposing the Accelerated Reform Fund bid that we've submitted. And one element of that will be to look at how we can potentially digitise a carer's card and sort of integrate carer identification and recognition across Sussex. And then also we're in the midst of a simultaneous engagement work project reflecting on what carers want from secondary care services. We have a benchmark from a couple of years ago of a general large-scale carer consultation, which drew out some key recommendations for what carers want from healthcare services. And we are reflecting on those once more, but with a specific focus on how that's being interpreted on the ground at secondary care services. So that's happening between now and the end of March. So that's been the beginning of our journey with hospital carer link work. And at that point, I shall hand over to Jennifer Twist from Care for the Carers.
Hello everyone, thanks very much, Tom. So over in East Sussex, as Tom's mentioned, we are also, as part of this project, working within the hospital setting. So our project is working within the Conquest Hospital in Hastings. So it's taking a very targeted approach to supporting carers at the point of discharge primarily. And as you can see from the slide, we've got the objectives are all around increasing our reach and providing broader support to carers by building kind of the onward referrals through to the Carers Centre. From ESHT, we're working with East Sussex Healthcare Trust around this project. And just overall also increasing the early identification and registration of carers and raising awareness around hospital staff, around the need to involve carers, but specifically involve carers in the discharge process, in planning discharge, and kind of the benefits of that in terms of supporting successful discharge, preventing readmission, and so on. So the approach we've taken is very much around building our partnerships, building relationships with hospital staff, co-producing solutions, looking at what works. We're aware that we're working with an incredibly stretched team in terms of the staff on wards and the trust generally. And so it's very much around an approach that says kind of how can we support? Let us take away the non-clinical support for carers and help help you by doing that. Within the project, there's also a focus on intensive support to carers. So this is one of our projects where, similarly to some work that we do within primary care, that is not dissimilar to everything that Anna was describing that's happening in West Sussex. We have a real focus on providing carer support in a different way. So within the way that the project is structured, we have the capacity to work more intensively and longer term with the carers who are identified through the project. So that's because it's kind of around the targeting of the project as well, because we know that by identifying carers at this point in their caring journey, we are likely to reach carers who have a greater need, who are dealing with a more intensive caring role, and potentially for the first time, or a changed caring role. So it enables us, I did see some of those questions coming through in the chat, and it enables us to manage the referrals coming in addition to our core work. It provides us the capacity to do that. Some of the challenges you can see on the slide, I've already mentioned the capacity of our NHS partners and colleagues is something that is limited, and that has had an impact on the work. One of the things that we are doing is providing Think Carer training, and we've had some real successes around that, but also some challenges in terms of the ability of colleagues within the hospital staff to take that up. And also for the project, we've had some impact of recruitment to the project itself as well. If we move on to the next slide, please, I'll talk a bit about the highlights so far. So again, very much around relationships, and for us, I think similarly to something that Anna mentioned earlier on, some of these may not seem like massive successes, but they are really significant steps, and sort of the things being achieved for the first time. So some of the opportunities that have been opened up are around the discharge hub, and this echoes Tom's experience over in Brighton, where being sited within the discharge hub is just a huge advantage around visibility, kind of within the hospital community, and also working with other colleagues who are absolutely focused on discharge and supporting that process. So some key partners for us there are the British Red Cross, who are also offering services supporting discharge and supporting successful discharge and kind of handoff into community services once that discharge has taken place. We also had some really great, very early successes around our Think Carer training. And again, this is to do with the relationships that we've established with our NHS Sussex commissioners and the way that they that they are positioned with the trust and with the discharge hub. So they were able to secure some spaces for us in a programme of training around discharge that was being delivered right at the very start. In fact, it started before the official start of the project, and gave us really good visibility across a high number of staff right at the get-go. So that was fantastic. Equally, it's helped us to kind of go out into the hospital with information stands, visiting wards, and really sort of looking at being our team being very visible within the hospital. If I move on to the what's next slide, please. That's lovely, thank you. So I guess a lot of this is about adapting and being fleet of foot. So I mentioned some of the challenges, being that actually the uptake of training has lessened as we've moved into winter and so on. And so one of the things we're doing is kind of changing how we do our networking and really upping the visibility within key wards. So looking at dementia, frailty, for example. So really looking at kind of building those relationships and focusing on increasing referrals from the hospitals. That's another of the challenges that we've had, is that whilst there may be some changes of behaviour and people starting to recognise carers more, that's not necessarily translating into the number of referrals that we'd want to be receiving. So at the moment, actual direct referrals through from acute staff, we're at about 10 per month on average, which we want to be obviously increasing quite significantly. So we're going to be looking at some of the things a bit inspired by some of the work elsewhere in this programme. So looking at some of the materials that we have available within the hospital, some of the digital solutions around making carers and the project more visible, the posters and resources and things like that. We're also looking at the Think Carer training and how can we make that more easily accessible to busy ward staff. So a digital option, learning from some of Tom's work and development in Brighton and Hove, so that could be a bit more bite size and for staff to be able to dip into. So we're also looking at our communications so that we're promoting a little bit more widely, and other ways that we might be able to reach into hospital staff teams, and so on. And then finally, just a little bit on staffing. That's been a real challenge. So we're currently looking at possibly looking at recruiting again, unfortunately. So we will be doing that in as quick a way as we can. But again, kind of really sort of placing an emphasis on building relationships and working with our partners in ESHT and NHS Sussex. And I think I will pause there. I'm aware there's lots of questions have come back in. I don't know whether, Caroline, would you like me to hand back to you, Caroline Pope, just to do a bit of a round off, or is it back to Caroline Cameron?
Happy to hand back to Caroline Cameron, I think, because then we might be asked to answer some of those questions, I think, Jennifer, mightn't we?
Yes. Thank you. Well, thank you for all three brilliant presentations. And I think the work that you're doing down in Sussex is very exciting. And also congratulations in managing to get the initial engagement with healthcare across Sussex, which I think must be one of the biggest struggles at the beginning, is to actually get that engagement from health. Now, we've got quite a few questions in the chat box. Steve, have you got any that you want to start with, or will I start?
Yeah, that's fine, Caroline, you go ahead.
Okay then. Rachel, I don't know if Rachel's still on the call, but Rachel was asking if this is an all-age partnership. So all your projects are all age.
Up on that? I mean, we're predominantly we're predominantly supporting adult carers, although there is some young carer support that goes on within our organisations as well. But I guess that the reality is, when we're raising awareness within GP practice, it isn't just about adult carers. We're also talking about young carers and raising the awareness of the challenges that they face. So there isn't a young carers provider organisation as part of this partnership, although we did work with Amaze on this partnership earlier, who support parents of parent carers. So it's predominantly adult carers, but we are involving young carers and identification of those within our conversations.
Oh, that's brilliant. Thank you, Caroline. Rachel also wanted to ask about how does this work link in with the social prescribing offer in Sussex? So the work that our GP practice will have to do around social prescribing.
It's probably best that I answer that one. Thank you for the question, Rachel. In West Sussex, we have 4 providers for social prescribing. Some of them are voluntary sector, 3 of them, 1 of them is local authority. So the nature of what they're commissioned to do and how they operate and how they receive referrals, it can vary. In terms of how we make sure that we're linked into them, at the beginning of this project, it was more focused on partnership on the ground, which we have across the way that we operate as an organisation is locality based. So we have locality teams that will be focused in particular geographies, and those relationships will be present on the ground. And we wanted to make sure, because what we're aware of is that many of the carers that aren't actually identified or flagged at primary care level get referred into social prescribing support, and then they'll get identified at that point. So it's really important that a social prescriber knows how to refer to us, but also there may be other things beyond their caring that means that a social prescriber might be the best suited to support them. So we have made sure in the materials that we've developed, and there's a particular section around partnership, and it's about the different roles people have to play, and for GP primary care partners to understand that, because we also have something called a carers health team in West Sussex, and they can provide support around annual health checks for carers, contingency planning, support around manual handling. So there's other key partners that we need to consider as part of we're part of that overall matrix. But we do want to formalise some of that. So, for example, initially we had a lot of social prescribers coming to our carer lead network, and it wasn't the best place for them to come along, and we have started inviting them to our carer learning sets because they focus on topics like caring with cancer, young carers, feeling confident talking with carers. But yesterday I met with the 4 delivery managers to engage with each of them around what might be the best way that this project can connect, because some of them choose carers as an active social prescribing commitment as well, because they're part of our core 20 plus 5. So it's an evolving picture, but we are making sure that the relationships are there on the ground and that we integrate them into how we approach the project.
Oh, well, that's brilliant, Anna. Thank you very much. Anna, another one that might be of relevance to you is Rachel again asked about the guardianship of children shouldn't be on the unpaid carers register.
Yeah, I think probably that was just not me being clear enough. So if a carer who has guardianship for a child who's got an illness, long-term condition, anything that makes them a carer, they should definitely be on the register. But what we found in our conversations with primary care providers is, you know, for example, a school, when they write a letter, will say, "Dear parents and carers." So they will have carers, so individuals that have got guardianship for a child, but there's no illness, disability, or any other condition present that means that they would be a carer as an unpaid carer. So there's just confusion around the terminology and registering people that actually don't have an unpaid caring role because they're referred to as a carer because of their guardianship responsibility. Hopefully that's clearer.
Oh, thank you, Anna. That's brilliant. Neil asked quite a few questions. I don't know, Neil, if you want to ask our lovely presenters yourself, or do you want me to read them out?
Shall I chip in? So I should declare an interest in
yeah, of course.
Involved with
yes.
For the care for the carers East Sussex. I'm just interested in how you think the partnership might have influence at a strategic or policy level, either at the kind of partnership board level or at the system level. I appreciate it's not been going all that long, but you're very well placed to have that influence.
Hi, Jennifer, do you want to answer?
I'll come in first. I'm sure colleagues might want to add. I think I think this partnership has helped us influence, and I think there's one of the things that I think maybe just to clarify is that the partnership is not only around the projects we've spoken to you about today. The partnership is much broader, and it's our 3 organisations coming together to engage in strategic dialogue with our partners, in particular at NHS Sussex. So this partnership enables us to speak up for carers kind of at that ICB footprint level. So it's definitely and given a bit of a space for that voice to come through, I would say. I think equally it has led to the forum that Caroline mentioned at the very beginning of our presentations, where we come together with both our local commissioners for carer services and the lead at the ICB. So that is a sort of growing forum in terms of its importance and the voice. So we've kind of it began sort of us saying, oh, wouldn't it be a good idea for us to get together? We're now moving into some more kind of formal strategic planning around making sure that there's a carers element that sits underneath the ICB plan and that also dovetails with our local carers strategies, although in East Sussex there's a clear you know, people don't want to call it a strategy, but for me, it's been a really helpful lever to be able to say we need a direction of travel strategic commitment in our county. And actually, you know, it's one of the factors that's enabled us to make that planning start to happen. So I think it's been a really helpful vehicle, and also it enabled us to say, actually, we have this partnership, we're ready, we work together, we know the needs of our local communities, and actually make an approach to the ICB for the funding to do this work. So, you know, the funding also followed as well.
Brilliant, thank you, Jennifer. And I think Jane Lodge has played a big part in it, hasn't she? And has been really pushing forward the carers agenda, which has been absolutely fantastic.
Absolutely, yeah.
And we've got another question here, is how the new NHS PCREF help hidden carers in diverse communities? So how, within your projects, are you able to, I think Anna, for instance, in your primary care project, are you able to, have you come across many carers from diverse communities that you've maybe managed to pick out when they come to the GP practice? So for instance, if somebody has come pushing somebody, that one of their relatives in a wheelchair, would somebody be able to go up to them and say, oh, hi, can I just ask you, do you care for this person in the wheelchair? Have you managed to pick up anybody from sort of hidden communities, harder communities? Because I think as healthcare professionals don't always ask those sorts of questions, and that's where a lot of hidden carers are, is that they're actually in sight, but we don't recognise them as that. You're on mute, Anna.
Sorry. In terms of the focus of the primary care engagement project, it's, our kind of starting place is, let's get them to think carer in the first place. So it's almost like you're one step ahead. So in terms of a lot of the conversations we've had, I'll give you a simple example. One of the mapping exercises, we were speaking with the carers lead and they were like, oh, our carers register is completely wrong because we've got children on it. So in terms of what our starting place, it's a lot of people don't actually fully comprehend who the different types of carers are. They often ask, how many hours do they have to be providing? Where's the eligibility around caring? They don't necessarily think that children might be caring, that parents with parenting responsibilities can also be a carer for that child, that there are adults that might be co-caring, that there are other working age adults that work full-time and still be a carer. So we're really, in the first instance, just trying to open eyes to the whole range and gambit of caring experience. As an organisation separately, we've done some work and actually as a partnership around hidden and diverse carer communities. I would say in terms of this project, actually, at the moment, the first one we're just exploring it at the moment is in Crawley. We have asylum and refugee, we've got some targeted work around asylum and refugee carers. So as part of our next engagement, we're doing a call out to all of the people that we've engaged with, the carer leads we've engaged with, and we're asking specifically around asylum seekers and refugees and in that community in particular. So I think I'm just saying, like, stage one for this project for us is think who all carers could be, and that's through a lens of and the materials we use, for example, is always making sure we represent a diverse community. The same with the Facebook messages. Everything is, stop thinking about the prototype that's in your mind, which is what a lot of them do. They've decided who a carer looks like, and start thinking who all types of carers can be, and that includes hidden and diverse communities. But the focus for us has been on all carers of all ages, with all caring experience, of all colours, of all faiths, that will present in a multitude of ways, and looking at key signs to look for in terms of caring responsibilities.
Okay, brilliant. Great stuff. Neil's also asked again about, has the VCSE Alliance taken a focus on unpaid carers? Jennifer.
The short answer is no. And just to explain, just to give a bit of context around. So in East Sussex, we have a voluntary sector alliance, and that's something that's been it's been in place for 4 or 5 years now. I'm currently the chair of that alliance, and that's similar to the way we've described our carers organisations working together. That's a way that in East Sussex the voluntary sector collaborates, discusses and forms a view on key strategic debates and issues, and also information shares around the needs of the communities that we serve, and also collaborate actually on some project delivery together. So in East Sussex, it's very much around actually the voluntary sector and the big issues that affect all of the communities that we serve in the Voluntary Sector Alliance. We also have a Sussex VCSE Leaders Alliance, which is a more sort of developing entity. And again, that's been very much about kind of the big strategic issues. So one of the things I have to be quite careful about as the chair of the VCSE Alliance and as a rep for the Sussex Alliance is I'm often getting kind of access to meetings and boards that I wouldn't otherwise have access to. So, for example, some of the cross-sector boards led by some of the leaders at NHS Sussex. But I have to go in and represent the voice of the voluntary sector. So, we get the carer message in where we can, but it's not always kind of about that.
No. Oh, I totally understand. Yes, it's a huge agenda that the voluntary sector have to cover. Well, it's getting near closing time. I'm afraid we haven't answered all the questions. So, Steve, can we put some of these questions together and send to the presenters and get some answers for the people? Would that be okay?
Yeah, that's fine. I've just put it in the chat box to say we'll take all the questions and
the
presenters will answer them, and we'll send them along with the slides and the recording link from the session.
Okay, that's brilliant. Oh, Tom?
I was just going to do a very quick answer to one of Neil's questions about whether what the impact has been on the partners in terms of increased referral rates, and just to say that we're going to get more information about that over time, Neil, and particularly when we come to do the end of financial year reporting. But my hope is, and my expectation is, that ideally we want to not even necessarily want to increase the overall numbers of referrals as a collective, but rather increase the proportion of referrals from these healthcare providers. The rationale there being that we want to be able to offer carers support at an earlier stage, and my suspicion is that before we had the hospital link workers in place, a number of these carers were coming to our attention, but only post-discharge, perhaps many months later, when another voluntary sector provider encounters a family in distress or a carer at breaking point. So hopefully that's some of the trends that we'll see.
Brilliant. Thank you, Tom. Okay, well, thank you everybody who's attended today, and I want to say a huge big thank you to all the presenters and the great presentations. Steve, can you tell us when the next Lunch and Learn is? Do you have a date for that? So we can get everybody ready for that one. No?
Can you see my screen?
Oh, all right. Yeah. I can't see it. I was looking at you. So our next meeting is on the 20th of March, 1:30 to 2:30. And I hope everybody has a lovely afternoon. And thank you so much, Sussex, for coming along and sharing your wonderful projects with us today. And that's all I have to say. So thank you very much. Bye, everybody.